This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. Good evening, everyone. I'm Angel Jacob, and this is MedTalk, your weekly on-air health consultation here on 9TV.
The pain in your stomach may last for hours and may become even more intense when empty. If this happens often, it is best to take more caution since it may not just be a case of stomach ache but a sign of peptic ulcer.
Peptic ulcer is any excavation in the lining of the gastrointestinal tract that can involve the esophagus, the stomach, the intestine down to the large intestine.
As a result, eating and swallowing food may become a chore and in some cases may even involve weight loss and vomiting.
The most common causes of peptic ulcer disease there are two. The pain drugs that we are taking for arthritis, or these are your pain medications including your aspirin. Plus, it is associated with Helicobacter pylori infection, which is a bacteria that resides in the gastric lining.
As with other diseases, peptic ulcer may lead to further complications, such as possible infections, internal bleeding, and scar tissue.
Peptic ulcer can lead to death, especially in complicated type of peptic ulcer. And then sometimes also, cancer in the stomach can also present as ulcer.
Medical experts suggest that the best way to protect yourself from peptic ulcer is to avoid vices, such as drinking and smoking, and be extra cautious in taking certain medications. What causes peptic ulcer? Can peptic ulcer be prevented? All these and more tonight on MedTalk.
Joining us tonight is Dr. Joseph Carlo Lazaro. He is a gastroenterologist at the Metropolitan Medical Center. Also joining us tonight is Dr. Therese Macatula. She's also a gastroenterologist at the Medical City. You may join the discussion by calling our hotline at 548-4678. Good evening, Dr. Therese and Dr. Carlo. Welcome to MedTalk.
Thank you.
As gastroenterologists, you take care of all the medical concerns of our stomach. So for tonight, it's about peptic ulcer disease.
Right.
So what is peptic ulcer, to start off?
Well, peptic ulcer disease, no, as the name implies, peptic is actually from the word like peptus or peptic is stomach, no, usually. So it's a disease of the stomach, no, that presents as ulcers, no, or the stomach has ulcers. No, ulcers in Tagalog is para mga singaw no? Para mga singaw, so para mga butas.
Yung
no?
dito naman. Yung
Yes,
sa
kasi
bibig
kapag
natin.
sinasabi mo parang mouth ulcers din siya, no? So dito naman what we're going to talk about today is yung ulcers sa stomach naman, no? So basically yun ang peptic ulcer disease, no? Now, the misnomer actually is pupunta sa iyo yung pasyente na, "Dok, meron akong ulcer." No? So
Nag-self-diagnose
na siya. So sabi,
Yes.
pagka ganun ng pasyente, sabi ko sa kanya, okay na, malis ka na. Alam mo na pala yung sakit mo. Hindi. Pero, but you know, ang peptic ulcer o pagka pumunta ang pasyente na merong, sinasabi niya meron siyang ulcer, it means na meron siyang nararamdaman.
Okay.
No? So, he or she may be presenting with symptoms of ulcer-like symptoms or parang mga simptomas na discomfort sa tiyan. So, we cannot label the patient as having peptic ulcer if hindi pa natin siya na-work up or na-investigate further. No?
Okay.
So actually, so again, yung peptic ulcer is a disease na dapat meron ka munang workups para ma-finalize natin na talagang peptic ulcer siya.
Okay, so tonight we will investigate further
Yes.
kung ano yung symptoms and then the workup and
Right.
then how these ulcers form.
Right.
So let's go to that na kaya. How do these ulcers form, Dr. Reese?
Well, ulcers are actually parang sabi nga niya, craters siya. No? So you have your normal mucosa, kumbaga parang ito, patag na patag. But when you have ulcers, meron kayong mga bako-bako. So may mga ukit yung inyong mga stomach lining.
Okay.
There are many things that can affect ulcers, yung sabi ng mga risk factors. No? Age is a risk factor. The older you are, the more prone you are to having ulcers.
Okay.
Having
Why age? I mean, what happens when we're older?
Well,
Why
it's-
is this age group more prone?
Well, number one, syempre wear and tear of the body, number one. Number two, older people are more prone to having infections that can, yung tinatawag nating H. pylori infection or Helicobacter pylori infection. Adults take in more medications
So
than
to answer
children.
that, okay.
Yeah. So these are some of the risk factors, and even behavioral or yung mga lifestyle ng mga adults different from children, which make them more prone to having ulcers like alcohol drinking and smoking.
So with all these risk factors involved,
They make you more prone to having these ulcers.
so even when kunyari, you're younger, you never had this problem. As you get older, because of the wear and tear and the accumulation of the medications that you're taking, mas prone ka.
Yes, yes. So
Getting
unfortunately,
ulcers.
yun nga, yung elderly ang mas prone, no? Kasi mas maraming sakit, no?
Right.
And that's why we see peptic ulcer disease more in the older age group than the children, no?
Okay. So what causes peptic ulcer disease? Dr. Reese?
Yeah. So for peptic ulcer, as I said, risk factors, no? Like medications such as NSAIDs, yung aming mga non-steroidal anti-inflammatory drugs, no?
For example,
For
what are
example,
these?
mefenamic acid, ibuprofen, naproxen, aspirin. These are the things that you take for pain. Aspirin is taken by people with heart disease, no? So when you take these things, the mechanism of action, kumbaga yung tina-target ng aspirin, meron din silang parang counter effect. Meron tayong effect sa stomach that can actually harm it, yung mga prostaglandins na sisira, what we call it. Kasi sila yung they keep the integrity of the stomach lining. So when you take it, meron silang systemic effect, may local effect sila that make you prone to have ulcers. Yung mga H. pylori infection, it's very ubiquitous, meaning it's everywhere, no? Washing of hands, improper washing of hands, properly prepared food. Yun yung mga that's how you get the H. pylori. You don't necessarily develop it right away when you have it, pero as time goes by, as it settles down in your stomach, no, sila rin yung nakakapagpa-ulcer sa...
So H. pylori, kasi you mentioned washing of hands, preparation of food, it's a bacteria
Yes.
that lives in your, or that,
Yes.
that stays in your stomach and may
It's a-
develop an ulcer
Yes.
because of that.
Because the stomach is diba, acidic. So most bacteria can't handle the acid of the stomach. But this particular type of bacterium, it has its own defense mechanisms to make itself live in that acidic environment.
So those with this H. pylori type of bacteria, will everybody who have it develop ulcers in their digestive tract?
Not 100%, but it makes them more prone. I've seen patients not necessarily with ulcers, although with some symptoms of parang hyperacidity. When we look at them, they don't have ulcers, pero meron sila yung mga superficial na gasgas lang, no? Or some erythema or yung pamumula ng stomach. No? So some of them can still have H. pylori without necessarily having the ulcers right away.
And this is seen via
Endoscopy.
an endoscopy. Kasi when you mention it, no, parang to the patient kami, sometimes when you have stomach, may ulcer ako. Parang yun na nga, self-diagnosis, di ba? But you don't really identify. It may be nalipasan ka ng gutom.
Yes.
There are some other causes that you might think that is peptic ulcer, but it's just a different stomach problem. You mentioned
Hyperacidity.
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 So how do you identify between hyperacidity and maybe an ulcer?
Well, the only way to find out if you have ulcer or not is really to see the ulcer.
Yun talaga,
Diba?
that's
You
the
have to
only
see it.
way.
Of course, you have more index of suspicion if the patient comes in with bleeding. Syempre may ulcer na, hindi yun pwedeng gas-gas lang talaga. No? But when you say stomach ache, Kasi
Yes.
I have stomach ache. Then that's why makulit ang doktor. Anong klase? Kailan nagsimula? Ano yung naka-trigger? So makulit kami magtanong because there are many different types and not everything is acid peptic disease or peptic ulcer disease. Minsan hapdi dito, yun yung pwedeng hyperacidity na tinatawag natin or yung acid peptic. Minsan tinatawag nila nag-heartburn ako. Yun yung acid reflux. Yung acid from the stomach, aakyat siya dito sa esophagus. Para siyang heartburn.
Parang
Yes.
GERD siya, no?
GERD,
Yes,
exactly.
reflux.
Okay. So, there are different, parang you have to distinguish talaga and you have to
Right.
explain to your doctor the level of pain, where the pain is located. Doctors will take a gap. Before we take a gap, let's leave them with this thought. How serious is an ulcer? And what are the symptoms? We'll talk about that when MedTalk returns.
Did you know that peptic ulcer is difficult to diagnose in pregnant women? And late diagnosis can result in the death of the patient.
We're back here on MedTalk, still talking about peptic ulcer disease. This time, doctors, let's talk about the symptoms of peptic ulcer para talagang mas maintindihan ng mga patients. How to identify the kind of pain or the level of pain or the area of pain so that they can explain it properly to the doctor.
Well, yung symptoms ng peptic ulcer, no, it's usually localized underneath the breast area or yung epigastric area na tawag natin. No, that's the area of the stomach and that's the area of the initial early part of the small intestine. No? Now, the character of pain, no, is very important. And the chronicity, how long has the pain been there, no, is very important also. So, minsan, the patients cannot describe well, no, kung ano yung pain na nararamdaman nila. So, it's the job of the doctors, no, to elicit kung ano ba talaga yung nararamdaman niya. Okay. Ulcer pains may be deep and knowing. Parang nandun lang siya. No? Nandun lang yung pain niya. No? It may occur before or after eating. It depends on the site of the ulcer. No? Okay. So, it can be also described as sharp pain. Masakit na masakit. No? So, usually, parang is to us more dangerous sign kapag sobrang sakit, no? Baka perforation 'yon. No?
Ano, may time ba yan na sharp pain, kunyari every 5 minutes or
kung may interval.
May interval ba yan?
Wala naman siya talagang interval, no? But then of course, sasabihin lang is how many minutes before eating or is it relieved by food intake, parang ganyan, no? So we have what we call the red flag signs. No? Red flag signs that we have to investigate further. Number one is if your patient is more than 45 years old, no? Presenting with a new case of epigastric pain, parang ganyan. Ano? Number two is weight loss. Patient has been suffering for long-term epigastric pain and then patient develops weight loss. No? So that's a danger sign. Number three, of course, is bleeding. No? Kapag yung patient is dumumi na ng dugo, no, that's a danger sign.
The black stool.
Black stools or red stools, ganyan, danger sign yan. Number four, if your patient has been taking anti-ulcer medications, but then wala pa ring relief ng symptoms, that's a danger sign. No? And number five, if the patient has family history of gastric ulcers. No? So that's the time that, well, parang late na siya, but it's a good time to consult your doctor. Parang ganyan. No? So, those can be signs of peptic ulcer disease or complicated peptic ulcer disease. No? But some other pains can mimic ulcers. No? Like, for example, the pain of gallbladder. No? Sometimes, parang peptic ulcer disease din ng pain niya. Number two is pains of dyspepsia. No? Simple bloating, simple belching, no? Simple fullness, no? Can be sometimes mistaken as peptic ulcer disease. But dyspepsia is a very benign and broad diagnosis, parang ganon, no? So we are guided by the warning signs, no, for us to be more aggressive kapag ganyan. No?
And these warning signs, there are more serious warning signs which need medical attention right away. no?
Right.
Gaya nung when they pass
Black stools.
bleeding already. So, ulcers, do we say that it's parang middle ground of being a serious medical emergency?
You can say that. No, you can say that an ulcer can become complicated. No,
Okay.
can become complicated when you have complications. The major complications of ulcer. So I guess it partially answers your question as to whether peptic ulcer is serious. No,
Yes.
so when the patient develops complication, then it becomes somewhat serious. No, so the major complications, the most common, will be bleeding. No, if your ulcer is too deep, no, sabi nga ni Dr. Therese kanina, if yung lining, no, is disrupted deep enough, no, to nick a vessel, to nick an artery, so it bleeds, no.
Right.
So it becomes serious,
kasi
no.
natatamaan yung
Yes,
vessel
kasi
na yun,
natatamaan
and then
yung
it
vessel.
erodes it.
It erodes, no. Number 2 is perforation, no. If your ulcer is deep enough that it
It's even
goes
deeper.
through to all the walls of your stomach, then nabubutas talaga yung stomach, no. Number 3 is because of intermittent or on and off inflammation ulcer. So gumagaling, nag-ulcer, gumagaling. So it can become or it can develop strictures, no. Ibig sabihin yung normal na daanan ng pagkain mo, in time, ang nangyayari, lumiliit na siya dahil sa ulcer, gumagaling. So nagiging maskip na siya, parang ganoon. So those are the major complications, no, of ulcers. And if untreated, pwedeng mapunta doon, no? And then it becomes serious kapag ganoon.
So talagang hindi dapat left untreated. When you notice these symptoms that you've mentioned, kailangan call your gastroenterologist right
Yes,
away and
yes.
explain. Or maybe see your gastro
Yes,
right
better
away.
see your gastroenterologist.
And then when you, in the event that you do see your gastroenterologist, what kind of tests will you perform or will you have the patient take to determine what kind of, what do you call that, scratch or maybe perforation the patient has in the stomach? Dr. Reese?
In the beginning, if there are no alarm symptoms, we can always say, sige, take these medications, no? Especially if the patient is relatively young.
Right.
Tapos yung sabi nga na alarm
What's young?
Mga 30, 20.
Okay. All right.
So less than 45.
Oh, but children don't get ulcers.
They can, but it's not
Not
as
likely.
often as
Yes,
adults
yes,
do.
yes.
Okay, so in mga 30s and
Yeah.
30s, 20s. Yes.
Okay.
So they can, if there are no alarm symptoms, you can actually treat them first. But if, as doctor said, no, may mga alarm symptoms, or you've treated them before, tas babalik na naman sa'yo, then it might be a good idea to offer tests such as, well, the gold standard for us is endoscopy. Endoscopy is a general term for, kumbaga, silip. No, you have an instrument that goes inside the body with a camera, and then you scope. You see it inside. No?
Okay.
For ulcers, it's specifically called esophagogastroduodenoscopy or EGD, upper GI endoscopy. No, so it goes through the mouth, the esophagus, the stomach, even the first portion of the duodenum, to see if there are any breakage in the lining of the stomach and intestine.
so the duodenum is the first.
portion of the very long small intestine.
Okay, so you go. That is the last part of your
Upper
endoscopy.
GI.
Yes, of the
Because
upper GI.
ulcers can still develop in the first portion of the very long intestine.
Oh, okay, so is it painful first when you do an endoscopy?
It can have a little discomfort, but we make sure that we do it as with little shenanigan as possible. So we spray. We have a lidocaine spray that will make the ano bang tawag sa Tagalog nun? Parang yung sa may bandang ngala-ngala.
Okay,
Yeah.
the one here.
Yes. So
Okay.
at the back of the throat,
Right.
kasi that's where we need to put in the scope. That's actually the the most uncomfortable stage when we do the endoscopy. So we put lidocaine spray. It's parang anesthetic that numbs it. Yun nga lang, medyo hindi rin makakalunok, no? Because it's very numb. But some patients who are a little bit more anxious, they prefer to be asleep, we sedate them.
Okay. And knowing that they have to undergo this procedure, it can cause a little bit of stress. Anxiety. But I think anxiety is not knowing what you have,
Yeah,
not knowing what's the activity in your stomach. So before we take a break, quickly lang, doctors. So let's say that you already are inside the patient's stomach. What do you hope to see?
Or maybe what we
What do we-
don't hope
Yeah,
to see.
what don't you hope to see? Or, maybe you hope to see a clean
Right.
tummy there, no perforation, no scars. But what are you looking for?
Well, ulcers, the craters, no? Makikita mo talaga the lining and then meron siyang mga uka talaga. As in, literally may uka siya.
Okay.
Of course, the more serious ones would be hindi na ulcers or maybe ulcer as the tip of the iceberg of a mass, no? Sometimes you also see yung mga on the benign side, yung mga very, very erythematous or reddish, so which means irritated siya by the acid, minsan may konting scratches. And then when we're inside, we also test for the H. pylori.
Okay, so there are several tests done, no?
Yes.
Which appeases the doctor and appeases the patient, na naa-appease din yung patient na, I have to, take the necessary medications, or maybe I just have to be careful with the type of food I eat or the type of medications I take in. Doctors, there are myths and facts surrounding peptic ulcer disease. So we'll talk about that when MedTalk returns. We're back here on MedTalk, still talking about peptic ulcer disease. Dr. Reese, Doc Carlo, myths and facts about peptic ulcer disease. Myth number 1 is stress causes ulcers.
That's a myth. No? I guess stress actually just worsens the symptoms of hyperacidity. No? Again, hyperacidity is a symptom. No? It's a symptom of general discomfort, no? Epigastric discomfort or abdominal discomfort. No? Sometimes, as I've mentioned earlier, yung ulcers can be equated to or associated with the symptoms of reflux. No? Reflux, parang ganyan. Sasabihin na ng pasyente na, meron akong ulcer, sumasakit yung ulcer ko, but it's actually reflux. No? So stress, among other things, no, can aggravate your symptoms of reflux or symptoms of epigastric discomfort or dyspepsia. But it does not cause peptic ulcer.
Okay, when you do an endoscopy, you don't see stress naman inside stomach.
No,
but
no.
it adds lang talaga, no? Stress is
Yes,
really,
yes.
sometimes it really tops the list of what can aggravate
Right,
your already
right,
existing or
right,
non-existing
right,
medical
right,
condition.
right.
Myth number 2, eating spicy food causes peptic ulcer. Dr. Reese.
No, it does not really cause the peptic ulcer per
Okay.
se. Like stress or the other things that they said can cause the ulcer, they can just aggravate some of the symptoms, no? Reflux primarily, but it's very different for the patients. One patient can have this as a trigger factor for the symptom, not for the ulcer. Then another person or another patient can just eat spicy food as
Yeah.
much as they want and not have anything at all.
Okay,
No?
even with a symptom of ulcer and you eat spicy food, hindi matatamaan, it won't aggravate.
Not the ulcer per se,
Not
not
the
the ulcer.
Okay, will the spice, okay, this is just will the spice actually kill the H. pylori bacteria?
No.
Don't.
No.
Okay.
Well, yeah, bacteria kasi is a bacteria. So
Yes.
the bacteria is killed by antibiotics.
Okay.
Unless your spice has antibiotics.
That's another myth. Yeah. Maybe the spice, maybe they can come up with a spice that has antibiotic, then a lot of people will start eating spicy
Maybe
food.
people might overdose naman. Masarap.
Okay, everything in moderation,
Yes.
everything. Okay. Next myth, drinking milk can heal ulcers.
No, actually, milk has parang rebound, what we call rebound hyperacidity. So it might aggravate the symptom of dyspepsia or yung paninikmura if you take it, but it does not heal the ulcers. There are medicines, we've come up with a lot of medicines already to actually heal ulcers. And if you have H. pylori as a trigger for the ulcers, you have to take antibiotics. Milk does not do any of those.
Okay, kasi before, di ba, the myth before drinking milk, the spice, they said that milk will heal naman. If you take spicy food for your ulcer, milk will heal it. It won't. Antibiotics will.
Yes, yes.
Okay, okay. Next, drinking coffee or alcohol and caffeinated drinks can cause peptic ulcer.
Well, coffee, just like stress and just like your spicy food, no, can aggravate your symptoms of hyperacidity or reflux. No, just a quick review on reflux. No, what is reflux? It's
Yes.
actually acid. No, the sensation of acid actually coming up the esophagus. Normally, your food or your acid should come from the esophagus down to the stomach, and then down to the small intestine. No?
Okay.
So there's a structure called the lower esophageal sphincter, the LES, in between the esophagus and the stomach. Its job is to constrict kapag kumain ka na, so that walang babalik na food or walang babalik na acid. No? So these factors, like for example, coffee, chocolate, alcohol, even to some extent stress, no, obesity also relaxes your sphincter, no. So kaya mas maraming patient na nakaka-experience ng reflux dahil relax na yung sphincter nila, so bumabalik yung acid, no. So again, parang it aggravates the symptoms of reflux, no. So coffee, pwedeng ganyan, pwede ring chocolates, and pwedeng alcohol. But smoking, although it aggravates reflux, alcohol also aggravates reflux, but it's a risk factor for developing ulcers.
Okay.
No?
Studies
So-
have shown they are more prone to
Right.
develop ulcer than the general population.
Right.
Okay, all right. Next myth, skipping meals is one of the main causes of ulcer. Dr. Reese.
Main cause maybe of the symptom of dyspepsia, but again, ulcers per se.
Okay.
Okay,
So, there's a difference na yung cause at saka yung symptom. Kung
Right.
anong makaka-aggravate dun sa existing symptom already of, in this case, ulcers. No? Okay, so skipping meals skipping meals in general is not a good idea.
yes.
Diba? Sometimes when you say, I have a headache because I skipped my meal, or my stomach parang, in Tagalog, there's that word.
Naninikmura.
Naninikmura,
Naninikmura,
because
right.
you skipped your meal. And then when you eat, then, you're relieved of
Relieved,
that
right.
pain that you feel.
Right.
No? So never skip meals. Next myth, there's no cure. You just have to live with ulcers. Is that true? No cure?
No, there are so many medications already. The most notable of these medications, what they call the proton pump inhibitors. So, and they suppress the acid production so that you don't have so much acid that will cause the ulcers. Now, if you have H. pylori as a cause of the ulcer, then you have to deal with that with the antibiotics together with the proton pump inhibitors. Now, if the cause is also NSAIDs or medications, you will just have to stop the medications, change the medication, so that you can address the other diseases that these medications need to address, and that you are still protected from developing the ulcers.
Okay.
Now, maybe I could go a step further. No? Ulcers, definitely Doctora is right that we have a cure for that already. If we go a step further and the patient develops complications, for example, no, maybe the patients would say na, or the relatives would say na wala na tayong magagawa. No? But in the day and age of endoscopy, no, therapeutic endoscopy, no, it's been a while since we had operations for the complications of ulcers. No? For example, we'll go back to the complications, bleeding. No? In maybe 20, 25 years ago, patients with bleeding ulcers are operated on. No? Now, because of endoscopy, no, we can apply clips, we can apply injections, and we can apply medications, no, on the bleeding ulcer. So it cures the patient. No? On top of course, the proton pump inhibitors and the antibiotics. No? Now, in cases of, for example, strictures, no, endoscopy also can help. No? We can put stents, no, dilate, put metal stents. Those we can do without opening up the patients. No? So, ulcer is curable. Even the complications are curable, no, with minimally invasive therapy.
Okay, that's good to know.
Yes.
Okay, you do not have to live with ulcers because there is a cure.
Yes.
Right.
And there are doctors like you who will help them live life,
Right.
the better quality of life, no, because of these medications, and of course consultation with you once in a while. Doctors, we have a Facebook question this time. I know that I have some over-the-counter medicines. I know that some over-the-counter meds may cause peptic ulcers, but what's a good alternative pill if I have a simple headache?
Well, a lot of patients would take the NSAIDs because they are NSAIDs, the non-steroidal anti-inflammatory.
Those are
drugs.
your ibuprofen,
Yes,
your aspirin, mefenamic acid.
Yes.
Okay.
If you have a simple headache, I think paracetamol would do.
Okay. All right.
So it won't cause ulcers, and there are only a good number of patients who do not get cured by paracetamol in terms of headache.
Okay. But the Facebook question zeroed in lang on the headache. Maybe,
Right.
baka may ulcer na siya, but may headache. Baka nalipasan din sometimes. Yeah,
Yes,
you can
tama,
attribute it to a lot of things
Yes,
when it comes to your headache and your stomach ache. Parang they're kind of connected.
Right.
Are they?
Sometimes.
A lot of patients have headaches when they skip meals,
Right.
and that causes the symptoms of that dyspepsia.
Okay, and hopefully they eat right away, so hindi na lumala, hindi na mag-scratch yung lining of their stomach, and it might lead to ulcers. Doctor will come back, we'll talk about treatments and medications, and there might be new findings in cure for peptic ulcer disease, or ulcers in general. We'll talk about that when MedTalk returns.
Did you know that some peptic ulcers, known as refractory ulcers, fail to heal because some types of bacteria are resistant to antibiotics?
We're back here on MedTalk, still talking about peptic ulcer disease. This time, doctors, let's talk about prevention. How do we prevent these ulcers from developing or from forming in our stomach lining? Dr. Reese.
I guess you have to go back to what are the risk factors for developing peptic ulcer disease. So, like taking of medications left and right. So, if they're not prescribed, don't prescribe them for yourself.
But sometimes kasi, for example, a friend of yours said, you know what, masakit yung tiyan ko, or I have an ulcer, I took this medication and it relieved me of the pain. Ano na nga yun? Can you give it to me? Because I want to... No, you should never do that.
Yes,
Kasi-
kasi there are different types of stomach aches. So as what we have discussed earlier, there are different types of abdominal pain. So it might not necessarily be the same disease that you're treating.
Okay.
So the other one is, smoking and alcoholic beverages. Alcohol, maybe social drinking, smoking, maybe no benefit at all. Maybe no more smoking.
Okay.
And then with H. pylori, so medyo mahirap nga because it's ubiquitous, it's everywhere, but I guess you can just prepare food properly, wash your hands all the time. So protect yourself from getting this H. pylori infection.
And this H. pylori, you'll only find out if you have it when the endoscopy is done. Is that correct?
There are also other ways, parang non-invasive ways of doing this. There's the breath test. no? Urea breath test, the stool antigen test. No? It will tell you, these two will tell you if you have it or if you don't have it. The blood test for H. pylori, it will just tell you that you've had it sometime. You won't really know if it's active now or not.
Okay. With medication, does that bacteria die and never come back?
Never come back? There's still a chance. No? When you treat H. pylori, there's an 80 to 90% chance that you will get rid of it. But of course, since it's everywhere, there's really no stopping the H. pylori from infecting you again.
Okay, just be careful na lang or just take the necessary medications. Speaking of medications, any new findings in the study of curing peptic ulcer disease, or maybe is there a new attitude of patients when they come to you? Are they more open to the endoscopy, and are they more open? Siguro, let's tweak it na lang a bit, no? And let's talk about the attitude of the patient when it comes to consulting with this type of medical condition. Doc Carlo.
There are no new major breakthroughs in the study of peptic ulcer because I think the cure, as you mentioned, it is already discovered, no? Kasi
You've nipped
we
it
know,
in the bud.
yeah, kasi
Great.
we know that it is because of the NSAIDs, and then we know that it is because of the H. pylori. So we know already how to treat it. Even if there are complications, we already know how to treat it. Now, the patients, the attitude, the health-seeking behavior of the patients, no? Although there have been improvements, no? But still, hindi pa rin, no? Especially in the areas where they think that medical costs are very high, no? So hindi sila kaagad nagpapa-check up, no? So we go back to the warning signs, no? If you feel those warning signs, no, seek a consult right away, no? Because as we always tell our patients, the complications, no, when the complication sets in, for example, bleeding, for example, perforation, no, yung ipang-check up mo, no, is more cost-effective if you seek help early, no, rather than wait for the complications of peptic ulcer disease.
Right.
No, so we have to. Well, I guess this show, no, is an avenue, no, to at least to let the patients know, no, that early prevention, early consultation will make a lot of difference.
Thank you. Yes, I agree. Facebook question this time, doctors. I have heart disease. If you need to take an NSAID, which are the ibuprofens and aspirin that you've mentioned, doctors, which one is safest for me? Dr. Reese.
Well, that's a little bit difficult because you will always have to consult your cardiologist, which is the best medicine for your heart.
Okay.
Okay. It's always really a risk-benefit check. If I take this medicine, will the benefits outweigh the risks? Of course, if you need to take an NSAID, for example, you had a heart attack, and you will need to take medicines for your heart, then we will just have to let you take them. Kasi mas instantaneous ang death ng heart attack than developing the ulcer over a longer period of time.
Yes.
But if, for example, you've already been having symptoms of the ulcer, then we can supplement, we can give you medicines for the ulcer together with the medications of the heart. No? Okay. So it's always really a risk-benefit check. No? You cannot disregard your heart if you really need to take something for it for the fear of having complications of these medications. Because as we said, there are already a lot of medications that we can give you to help support the stomach.
Okay. Speaking of medications, I just want to go back to the NSAIDs now. You mentioned that it can be a risk factor or it can trigger the ulcers. Taken in moderation is okay. Once in a while is okay.
And usually, when you take medications like mefenamic acid or ibuprofen, we ask you to take them on a full stomach.
Okay. All right. Okay. How about, doctors, the importance of reading your medications or of knowing your medications before intake?
That helps a lot. No? Of course, the doctors will tell you about it when they prescribe. But if there are certain things, for example, that you forgot to tell your doctors and then you read it, bawal pala siya sa ganyan, or mayroon pala siyang side effects na ganyan. If you yourself know that meron kang particular, kunyari, side effect nun, prone ka, then it would be good to read it. Although sometimes people read and then they scare themselves. So if you have a question, you can always go back to your doctor and ask.
Okay. How about a lifestyle change that you can make to avoid having peptic ulcer disease? The H. pylori bacteria, can't really avoid it.
It's everywhere.
It's everywhere, but you can, how do you say that? You can suppress it? You can,
You can
don't have
try
to
to
feed
decrease
it.
the chance of having it
you decrease the chance of having
by
it.
observing proper hygiene.
Okay.
Those that are modifiable, risk factors for ulcers would be smoking. It's not good for the stomach, it's not good for the lungs, it's not good for the heart, it's not good for anything, except for passing time maybe. So get rid of the cigarette. Number 2 is alcohol also. Alcohol, you can modify it. Decrease your intake, or at least, or some persons can discontinue it permanently. So as for lifestyle changes, I would add maybe your drug intake. Your drug intake, you should be educated as to your drug intake. Because in the day and age, especially here in our country, where we can get medications over the counter, so it's very dangerous, especially in uneducated or uneducated person do not know the side effects of the drugs. So that's where internet comes in, social media comes in, and your doctors come in to help you. So those are, I think, the lifestyle changes that you can do.
Okay, would you say that's also your final message to all our viewers, Doc
Yes,
Carlo?
yes. Educate yourself and empower yourself. And if you are not sure, consult your doctor.
Always consult.
Also.
Dr. Reese, final message to all our viewers?
I would agree with Dr. Carlo. If there's any doubt as to how you feel, you can always ask. There are doctors all around you. There are small clinics, big hospitals, so that it's very easy to access a doctor to give you that knowledge that you need for your disease. It's very difficult to treat yourself. Of course, the internet, you have all these the media things that can help you understand. But you should always have a doctor to help you put things in perspective, because sometimes you end up scaring yourself or misunderstanding everything that you read.
So thank you very much, Dr.
Thank you.
Therese
Thank you.
Makatula, Dr. Carlo Lazaro, for helping us understand more about not scaring ourselves, yes, no? And taking good care of our stomachs, okay? And, aside from taking good care of our stomach, it's also the understanding of the kind of pain, the level of pain, and the area of pain that you have, so you can express the pain that you have to your doctors
Correct.
properly. So maraming salamat ulit,
Thank
Dr.
you.
Reese.
Thank you.
See you again next Tuesday, 7 p.m. here on MedTalk, your scheduled on-air consultation on 9TV. This is Angel Jacob. Good night.